Rachel had exactly 10 minutes to expose a multi-state murder conspiracy before becoming the next victim. Kane signaled his associates. Take her to the parking garage. 7th floor. Make it look like she jumped. Rachel's mind raced. 7 years working nights had taught her every hospital emergency protocol. She had one desperate chance. As they escorted her to the elevator, Rachel suddenly collapsed, convulsing violently. "She's seizing," one man shouted. In the confusion, Rachel broke free and lunged for the emergency broadcast panel near the nurse's station. She grabbed the microphone used for hospital-wide announcements. "Code Gray. This is Nurse Rachel Thompson. Hospital administration is murdering patients for insurance money. Robert Kane and Dr. Hayes are killers. Call police now." Her voice echoed through every floor before Kane tackled her and cut the feed. "You stupid woman. You have no idea what you've done." Kane grabbed his phone. "Execute cleanup protocol. All evidence, all witnesses now." But Rachel's announcement had been heard by more than hospital staff. FBI agent Michael Torres, Agent Warren's replacement, was monitoring communications from outside. Alarms blared as police and FBI agents stormed the building. Kane and his men were trapped in the administrative wing. Dr. Hayes frantically tried destroying computer servers, but hospital IT staff, now understanding the truth, had locked him out. "Let her go, Kane," Agent Torres shouted through a megaphone. "We have everything recorded. It's over." "You have nothing without the server data," Kane screamed back, holding Rachel at gunpoint. But Kane was wrong. The recording device had captured his confession about 400-plus murders across 17 hospitals. More importantly, FBI raids were simultaneously hitting MedCorp Holdings offices in 6 cities. Kane's phone buzzed with updates. Phoenix office raided, Denver arrests made, Miami servers seized. His entire network was crumbling in real time. "Boss, it's over," one of his men said. "They got everybody." After 4 tense hours, Kane finally surrendered when he realized his criminal empire had collapsed. The investigation revealed staggering scope. 427 patients murdered across 17 hospitals, $89 million in fraudulent insurance claims, involving 63 doctors, administrators, and corrupt officials. Robert Kane received the death penalty. Dr. Hayes got life without parole. 12 other doctors received sentences from 25-50 years. Agent Lisa Warren was sentenced to 35 years for corruption and accessory to mass murder. But Rachel's greatest victory was systemic change. Her congressional testimony led to the Healthcare Whistleblower Protection Act, creating new safeguards for medical staff reporting violations. 8 months later, Rachel stood before a Senate hearing on healthcare fraud. "Senators, I was just a night nurse doing my job. But I learned that sometimes the people society overlooks, nurses, support staff, night shift workers, are the ones who see what's really happening to our most vulnerable patients. Healthcare exists to heal, not to profit from death. Every patient deserves someone willing to fight for their life." Rachel now serves as Director of Patient Safety Investigations for the Department of Health, earning $95,000 annually and preventing similar conspiracies nationwide. She travels the country training healthcare workers to recognize suspicious patterns and protect patients. The new systems she helped design have prevented an estimated 300-plus additional murders at hospitals across America. On Rachel's desk sits a framed letter from Maria Patterson. "Dear Rachel, my husband celebrated his 68th birthday last month surrounded by grandchildren. You didn't just save one life, you saved our family's future. Thank you for having the courage to risk everything for strangers." Next to it, Rachel keeps photos of all 427 victims whose names she memorized. Every morning, she looks at their faces and remembers why she chose courage over silence. Rachel Thompson proved that one person willing to risk everything for truth can save hundreds of lives. She showed that healthcare workers have both the opportunity and responsibility to protect patients. If you work in healthcare, remember Rachel's story. Sometimes the most important thing you can do is refuse to stay silent when lives hang in the balance.